it may take a lot of Wi-Fi connection. So I will reduce the video for some time, and only audio will be visible to you. Is that okay?
Yes, ma'am.
Okay, just a minute.
Yes, ma'am.
Okay, ma'am.
Okay. All right. So now we will start with today's topic, that is women and mental health. Before starting the topic, one issue that I would like to highlight is, since I am sharing the screen and lecture from my home, sometimes there may be a power disruption, and due to which Wi-Fi may go off briefly for about a couple of minutes. So kindly bear with that inconvenience if it happens. Then I will try to log in through the phone. So that is the only instruction that I want to give. So next we will move on to the presentation. So let me start with how we are going to proceed. Today we have 2 sessions in the morning between 10 to 11:15. I want to present this first part of the lecture, that is Introduction to Health and Mental Health, Mental Illness, Magnitude and Impact, Types of Mental Illnesses, Treatment and Rehabilitation, and Women and Mental Illness. After that, between 11:15 to 11:45, we have a break. And after the break, in part 2, we will have discussion on women and mental illnesses. That is, what are the vulnerabilities of women as a group to mental illness? What are the interventions that we can give? And topic covering stress and mental health. And finally, tips to maintain mental health in personal and professional life. So these are the topics that I would like to discuss upon or touch upon during my sessions. Hope that will be okay with all of you. And after part 1 and part 2, we will have about 7 to 10 minutes for questions and answers. In between, if you have any questions, queries, you can post it in the chat box so that we can read it and then further take it up for discussion. Thank you. So I want to start first with an activity. From all of you, I want to hear first as to what do you understand by mental health? You can define it in a word or in a sentence. How many of you are present now in the session? I think about 35 people, 37, isn't it? But leaving the host, HRDC, I think there may be 35 people, right? So quickly. So can you share?
Mental.
Yes, please.
Yeah. Good morning. So
Very
mental health is actually our mind should be there in a sound state. That means there should not be any, what we can say, dejection or depression or disappointment. All those things should not be there. It should be there in a very pleasant mode and pleasant mean.
Okay. Thank you, Vani madam. Okay. That's quite a big definition and a tall one too. Thank you. Next, please. Quickly.
Madam, I think mental health is what to say. It is when an individual realizes his or her own abilities.
Okay. Knowing their abilities. Right.
Yeah.
Okay. Thank you, madam.
Having a sound mind.
Having a sound mind. Okay. Right.
Madam,
agree. Sorry? I couldn't hear that.
Psychological condition.
Psychological condition means what, sir? What is mental health? Andre psychological condition andre ಏನು? ಅಂದ್ರೆ ಕನ್ನಡದ ಯೂಸ್ ಮಾಡಬಹುದಲ್ವಾ? Okay,
Emotional state, madam.
emotional state.
Yes.
Okay. Okay.
Madam,
Right. We will
willpower.
come. Heli?
Willpower.
Willpower. Okay. Mental health means willpower. Okay. Right. Okay. Amele?
Balanced mind.
Balanced mind. Okay. Interesting.
Positive thoughts, no wrong thoughts. Like
Positive thoughts. Not much of negative thoughts. Okay.
Knowing about right and wrong, ma'am.
Knowing about right and wrong. Okay. Right,
Ability
sir.
to take decision, ma'am.
Decision making. Yes.
Decision making.
Very good, ma'am.
Ability to control his emotions.
Ability to
control our emotions.
control our emotions. Okay.
Managing stress, ma'am.
Trust, is it?
Stress. Managing stress.
Managing stress. Okay. Yes. Good one. Right.
Adjustment to environment.
Adjustment to environment. Okay. Right, sir.
Managing equilibrium between cognitive and emotional function, ma'am.
Yes. Managing between cognitions and emotions. That is balancing thinking and feeling. Right,
Yes.
madam?
Yes, ma'am.
Last one. Anybody else?
Madam, peace of mind. Madam.
Peace of mind. Okay. Right, sir. Thank you very much. So with that, I know there are others who would like to also share, but because we have to run the session a little faster, we will go to what the WHO says about mental health. Okay. So first, let us look at what is health according to WHO. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. With this, they also added in 1984 spiritual health, and also said that ability of the individual to contribute positively to the society. So these are the parameters for what we call as health. So when we come to mental health, it is defined as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So this is what you all have also shared. It's a state of well-being. That means feeling well, having peace, being in equilibrium, and able to realize their abilities, potentialities, and they can cope with normal stresses of life. Please note the word normal stresses of life. They can work productively and fruitfully, and they are able to make contribution to their community. This is considered as mental health. And as we all know, mind and body are the two faces of a same coin. So physical health and mental health are what we call psychological health or emotional well-being, though they are a little synonyms as well as slight difference is there. They are basically talking about having a balance, having a healthy living which has physical health, mental health, and they are able to contribute socially as well as spiritually. So it is a term used to describe either a level of cognitive or emotional well-being as well as or an absence of mental disorder. So what is health ಅನ್ನೋದಕ್ಕೆ when there is no illness, that is health ಅಂತ ಕೂಡ ಹೇಳ್ಬಿಡ್ತಾರೆ. ಹಾಗೇನೆ what is mental health ಅಂದ್ರೆ absence of mental illness is mental health ಅಂತ ಹೇಳಿ. ಆದ್ರೆ WHO definition ಏನ್ ಹೇಳುತ್ತೆ ಅಂದ್ರೆ mental health does not mean only a mere absence of disease or infirmity, but it is a state of well-being. So where the individual himself or herself feels that they are doing good, they are feeling fine, they are really positive about things. So when these parameters are there, then we say that a person is mentally healthy. In that case, we have to look at what is mental ill health also. When we define health, when we say that they have to have their own abilities, they must be able to cope with normal stresses of life. They must be productive and fruitfully working, and they must make a contribution to the community. There should be a balance of cognition and emotion, that is thinking and feeling levels. When we say all that, we have to also say what is not there. When we know what is not there, we can compare it with what is there and say whether we are at the moment healthy or not healthy. So in order to do that, we need to also look at hagadre, what is mental illness anta heli. Adakke modalu, let us look at some statistics. The magnitude and impact of mental illness.
Madam, ಅದು slide show mode ಅಲ್ಲಿ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ.
ಹೌದು, ಆದ್ರೆ ಅದು ಮಾಡಬೇಕು ಅಂದ್ರೆ ನಾನು ಸ್ಟಾಪ್ ಶೇರ್ ಮಾಡಿ ಮತ್ತೆ ಮಾಡಬೇಕು. ಮಾಡ್ಲಾ? ಓಕೆನಾ? If everybody is okay with it, I will do it. Okay, I will do that. ಓಕೆನಾ ಸರ್? ಕಾಣಿಸ್ತಾ ಇದೆ ಈಗ?
Yes, madam. Thank you.
Okay, madam.
ಓಕೆ, ಆದ್ರೆ ಇದು ಮೂವ್ ಆಗ್ತಾ ಇಲ್ವಲ್ಲ, ಸ್ಲೈಡ್ ಮೂವ್ ಆಗ್ತಾ ಇಲ್ಲ.
ಪರವಾಗಿಲ್ಲ, ಹಾಗೆ ಮಾಡಿ ಮೇಡಮ್.
ಒಂದ್ ಸೆಕೆಂಡ್ ವೆಯ್ಟ್ ಮಾಡಿ, ಇದು ಟೆಕ್ನಿಕಲ್ ಇಶ್ಯೂಸ್ ಸ್ವಲ್ಪ ಕೈ ಕೊಡುತ್ತೆ. ಸರ್, ನಾನು ಹಂಗೆ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ, ಇಲ್ಲಾಂದ್ರೆ ಫುಲ್ ಸ್ಕ್ರೀನ್ ತಗೊಂಡ್ರೆ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಮೂವ್ ಆಗ್ತಾ ಇಲ್ಲ ಇದು. ಇಫ್ ಎನಿ ಒನ್ ಆಫ್ ಯು ಕ್ಯಾನ್ ಸಜೆಸ್ಟ್ ಹೌ ಟು ಡೂ ದಟ್, ಐ ಕ್ಯಾನ್ ಟೇಕ್ ಇಟ್ ಅಪ್. ಇಲ್ಲ ಅಂದ್ರೆ ಐ ವಿಲ್ ಗೋ ವಿತ್ ದಿಸ್ ಓನ್ಲಿ. Okay. So now when we talk about magnitude of mental illness, all over the world, 1% of the population, this is from various epidemiological studies conducted by the WHO. 1% of the population suffers from major mental illness. So 8 billion population ಅಂದ್ರೆ ಎಷ್ಟು ಜನ ದೀರ್ಘವಾದಂತಹ ತೀವ್ರತರವಾದಂತಹ ಮಾನಸಿಕ ಕಾಯಿಲೆಯಿಂದ ಬಳಲ್ತಾ ಇದ್ದಾರೆ ಅನ್ನೋದು ನಿಮ್ಗೊಂದು ಅಂದಾಜುಗಳು. 1% ಆಫ್ ದ ಪಾಪ್ಯುಲೇಷನ್. ನಮ್ಮ 140 ಕೋಟಿ ಜನಸಂಖ್ಯೆಯನ್ನ ನೋಡಿಕೊಂಡ್ರೆ ಎಷ್ಟು ಲಕ್ಷ ಜನ ಈ ಒಂದು ತೀವ್ರತರವಾದ ಮಾನಸಿಕ ಕಾಯಿಲೆಯಿಂದ ಬಳಲ್ತಾರೆ ಅನ್ನೋದು ನಿಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. And it is estimated that anywhere between 10 to 12% of the population suffer from minor mental illnesses. That is anxiety, depression, alcohol and drug abuse, phobias, psychophysiological disorders. Like that, there are very many types of mental illnesses. And it is also reported and clinically established that nearly 15 to 20% of patients who visit general practitioners for related to physical health actually suffer from symptoms which are basically psychological in origin. That means they show physical symptoms, but the reason for physical symptoms is basically their mental state, not a physical state. So this shows that what we think as very less number of people suffering from mental illness is actually a wrong notion. There are a large number of people. If we look at this statistics itself, nearly about 15 to 20% of people have some or the other issues related to mental illness. And that we don't know because it is an invisible and unreported group of illness, because of fear of stigma and lack of awareness. ಕಂಡು ಕಾಣದಂತ ಕಾಯಿಲೆಗಳಲ್ಲಿ ಈ ಮಾನಸಿಕ ಅಸ್ವಸ್ಥತೆಯನ್ನ ನಾವು ಗುರುತಿಸ್ಕೋತೀವಿ. ಯಾತಕ್ಕೆ ಅಂತ ಹೇಳಿದ್ರೆ, ನಾನು ಮೊದಲನೇ ಹೇಳ್ದಂಗೆ ಜನರ ಮನಸ್ಸಿನಲ್ಲಿ ಈ ಕಾಯಿಲೆಗಳ ಬಗ್ಗೆ ಅರಿವಿರಲ್ಲ. ಇಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಅರಿವಿದ್ರುವೆ ಹೇಳಿದರೆ ಯಾರು ಏನು ತಪ್ಪು ಕಲ್ಪನೆಗಳು ಮಾಡ್ಕೋತಾರೆ ನಮ್ಮ ಬಗ್ಗೆ ಅನ್ನುವಂತಹ ಭಯ. ಇದು ಕಂಡು ಕಾಣದ ಕಾಯಿಲೆಗಳ ಗುಂಪಿಗೆ ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳು ಸೇರ್ಕೊಳ್ಳುತ್ತೆ. ಸೊ ಈ ವಿಷಯದಲ್ಲಿ ಈಗ ನಿಮ್ಮಗಳಿಗೆ ವಾಟ್ ಯು ಪೀಪಲ್ ನೋ ಅಬೌಟ್ ಮೆಂಟಲ್ ಇಲ್ನೆಸಸ್ ಅಂಡ್ ವಾಟ್ ಆರ್ ದ ಮಿತ್ಸ್ ಅಂಡ್ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ಸ್ ಅಬೌಟ್ ಮೆಂಟಲ್ ಇಲ್ನೆಸಸ್, I would like to listen from you. So again, I want you people to start sharing quickly.
Depression, anxiety.
Yes, depression is a mental illness. Agreed. Yes, sir. Sorry, anger.
Anxiety.
Anxiety. Yes, anxiety is also a mental illness. Correct, sir.
Stress,
Anxiety. Stress is also mental illness. I am talking about what are your conceptions about anxiety, stress, depression. What do you think? What are the reasons for this?
There may be ways.
Madam, sometimes frustration in our life, or if any of the things, if it is not satisfied or it is not according to our expectation, then people may take it in very seriously.
Okay.
Or
right.
they may go to the saturation point and they may consider that our life itself is not what we can say meaningful, and they may even suicidal tendency may start with them.
Okay. Okay. So you think all these are symptoms of mental illness?
Yeah.
Okay. Thank you.
Madam, trauma, any traumas that they have undergone during their childhood
Okay.
or recently can be reason for mental illness.
Okay. Traumas can lead to mental illness. Yes. And then, what are the myths about mental illness? I am asking about that. What are the, in common people, what are the beliefs that are there about mental illness?
Mental illness cannot be cured.
Yes, very true. This is one of the major misconceptions and myth about mental illness, that mental illness cannot be cured. So that is one reason why people either don't want to share that they have mental illness, or they feel that even if they share, there is no treatment available, or treatment is not going to lead them anywhere. So because of that, they also do not come forward to share their mental illness. Yes. Any other myths?
People think that these people cannot mingle with normal people.
Yes, they feel that very
they
true.
think it's very uncommon.
Yeah.
Like that.
Okay. So they think that. What is the reason for that, madam? Any ideas? Why they think mentally ill cannot mingle with normal people?
Worries.
Anybody else? Yes. Hello. Why do you think people feel that they cannot mingle with normal people?
It is not our thinking. It is the thinking of many people who say, because they feel that they are not behaving in the manner in which they are behaving in certain circumstances or conditions or like that and all. They think that they will not react properly or they overreact at times. So they feel that it is not proper to take them. If we have someone in our house, we feel that it is proper to take them outside because they might not behave properly or hurt somebody. It depends on the type of mental illness.
Very true, madam. So the socially inappropriate behavior can cause embarrassment to the people around them. And that is the reason why they feel they cannot be mingling with all of us. Right, madam. Very valid observation. Yes. And any other myth?
Because they don't have knowledge about what is mental health itself.
Yes, that is true, sir. Common people usually do not have much knowledge about mental health and they have a lot of misconceptions. True, sir. One more misconception here which stops people from mingling with mentally ill is related to people thinking that mentally ill are harmful to the society. They can cause disruption and they can be harmful in the sense that they can cause physical harm to others and they are criminals. This is another misconception which makes people to say institutionalize or put them behind the bars. Another misconception is about mental illness and mental retardation. Many people confuse mental retardation with mental illness. What is mental retardation? It's a delay in brain development. So that can cause people to have a disability. But it is different from mental illness because mental retardation can be from an early life, whereas mental illness can develop at any point in life. So, mental illness is different from mental retardation, but many people get confused between mental retardation and mental illness. Another myth is that mental illness is basically due to black magic. I think you all know about it, right? People believe that due to some evil spirits or somebody causing with evil intention, putting negative energy, that persons become mentally ill. So they go for faith healing techniques instead of seeking treatment. And the third belief is that mental illness will get cured if they get married. So this myth also causes a major problem in the sense that people, instead of seeking treatment, they will start looking at the option of getting the person married, which does not really resolve the mental illness, but rather compounds the problem. So these myths combined with, limited number of mental health resources in terms of trained mental health manpower, in terms of the beds available for treatment, in terms of facilities available for treatment, availability, affordability, and also accessibility. These three are very less for mentally ill in our country. Because of this, the people are unable to reach to the hospitals where they can get treated and get out of the mental illness. And what is the impact of mental illness? Loss of productivity, loss of quality of life, and chronic suffering, not just for the patient, but also for the family. So, when we look at types of intelligence, we will be able to highlight upon why I mentioned loss of productivity, loss of quality of life, and chronic suffering. So, we will move on to the next topic, that is types of mental illness. Am I clear? Is the flow of presentation okay with all of you?
Yes,
Should I
madam.
go faster?
Yes, ma'am. No.
Okay, I will continue like this. Right. So when we talk about, yes, thank you. When we talk about types of mental illnesses, we have major mental illnesses. This again, scientific classification is different. For that, WHO has given out a standard called International Classification of Diseases, and North American Association, Psychological Association has given a DSM, Diagnostic and Statistical Manual for Diseases. So those two manuals define mental health in a very professional way, mental illness types in a very professional way. But for the common understanding of this group, I have made it into rough categories like this. So one broad category is called major mental illnesses, and they include 2 or 3 illnesses. One of the illnesses is called schizophrenia. The other illness is called, it's a mood disorder, bipolar affective disorder, or commonly known as manic depressive psychosis. And psychosis itself is called as a major mental illness. Many a time psychosis may not get classified. So what are the classic features of these major mental illnesses? One is that usually they start during adolescence, or during the ages of youth. The symptoms will usually start there, that time. And in schizophrenia, it is basically related to the individual's thoughts. The person thinks, or his thought process gets wired differently due to a number of endocrinal factors, imbalances, hormonal imbalances, leading to thinking that people are out to harm them. So they suffer from what we call in mental illness terms, delusions and hallucinations. What are delusions? They are called fixed false beliefs, which are very firmly held by the individual. Just for example, think that I consider myself to be the Israeli Prime Minister. And I think all the world is against me and against Israel. So if I firmly believe that I am the Israeli Prime Minister, if my thought says so, then I consider all of you as my enemies. And any action that you take, I feel that you are doing it to harm me. So this is a type of delusion. It is false, but I believe it firmly. And once I believe it, I start acting on my belief. So whatever you say, I think you are trying to harm me. So as a gesture to protect myself, I may in turn come and hit you before even you even know what is happening. So that is the impact of delusion. This delusion can also be due to a phenomena called hallucination. That means without any external stimuli, I may be hearing voices. The voices may seem to be telling me, you are Benjamin Netanyahu and all others are your enemies. They are out to kill you. They are out to bomb your country. So you have to protect yourselves. So what should you do? You take a gun and shoot everybody. So if I have a licensed gun, I will just take it out and shoot all of you. That is the impact of hallucination. So this is what causes the individual to act in a way that looks totally abnormal and harmful to others. So these are the hallmark symptoms of schizophrenia, which usually start between the adolescent age group, let us say 12 to 18 or 20 years. Sometimes we have late onset schizophrenia also. There are various types, but this is one of the major mental illnesses. And the second one is called bipolar affective disorder. This is a mood disorder. So in this mood disorder, person can feel extremely high, happy, excess of happiness, that is called mania. And that can lead to excessive irritability and uncontrollable anger, overactiveness, and also loss of, socially appropriate behavior. And the other part of this is depression, major depression, where the individual can go to a level where they become totally immobile with, an undescribable sadness and suicidal ideation. Many people act on this also, that they commit suicide due to major depression. So these two are called major mental illnesses. When I gave you the statistics about, 1% of the whole world population suffers from major mental illnesses, we were referring to these two illnesses, that is schizophrenia and bipolar affective disorders. Now, when we look at impact of this illness on the individual and the family, in terms of productivity, if a young boy or a girl of 12, 14, 16, 20 gets any of these diseases, what happens? First and foremost, they are not able to understand. The family also doesn't understand. The patient also doesn't understand. They are not able to go and seek help. So when that happens, the delay in seeking help causes aggravation of the symptoms. And symptoms increases, the illness is becoming longer, but they cannot approach the treatment because they don't know whom to approach. Many of them go for faith healers. So what happens? This is the age group where they are supposed to get trained for their future life. Education suffers. They become school dropouts, college dropouts. And if they are going to the jobs, they stop going to the jobs. Personal care is affected. And they become socially isolated. And emotionally, they are not able to understand what is happening to them. And if they don't take treatment on time, then this outcome of this or prognosis in major mental illness is that nearly 35% have only one episode and they get out of it. Another 35%, 30%, they have some symptoms, they may have relapses, but they can function at, let us say, about 65 to 75% level. But there is another group of 30 to 35% people who do not get cured. So it is these 30 to 35% of people who become unproductive, who become dependent on the family. And please note that they are only having problem in their thought process or emotional, reasoning process. And they are physically all right, but they are not able to be productive or give any fruitful contribution to the society. And they become a burden on the society. So burden on the society means what? On their immediate family members. And they are not able to be productive and they have become a burden on their families. So this causes a lot of financial, physical, as well as emotional upheaval to the family as well as the individual. and the burden of illness is too high. Even if they take treatment, these 35%, the last 35% that I mentioned about, they are not able to get out of the illness. They become chronic mentally ill. Many of the wandering mentally ill that you see on the roads, they are the sufferers of these major mental illnesses. And the problem with these people is that they require rehabilitation, but unfortunately, rehabilitation is not so easy and it is a very long drawn process. This is the major factor in making mentally ill a burden on the society. The next type of mental illness is what we call as a spectrum of minor mental illnesses, under which broadly we can say about what you all mentioned, anxiety spectrum disorders, we call that as anxiety, phobia, panic attacks, and then neurotic depression. And these are some of the major things which I am talking about. So anxiety, all of us have faced. We all have some fears. We have some panic attack also maybe. And we all feel stressed and also have symptoms of depression from time to time. But what the definition of mental health said? It said that they should be able to handle normal stressors. Many a times we are not able to handle the normal stress also when the stress is cumulative. That means one stress building upon the another. So when that happens, it is like the last straw on the camel's back. So when that happens, the individual's ability to cope with the challenges that are presented becomes difficult, and the person may become dysfunctional for some time, and at that time they will seek help. That is called minor mental illness. So this is about what I mentioned in the earlier thing. 10 to 12% of the population might suffer from minor mental illnesses. Now, because of these minor mental illnesses, the individual suffers. Their quality of life suffers. When they have anxiety, they are not able to perform very well. But most of them are able to hide the anxiety. Or many a times, what they do is they avoid situations where they get the anxiety. For example, as teachers, you all know, there are many students who have social anxiety and also stage fear, what we commonly call as, okay? And these fears make those students to not come for any presentations where they have to give presentations. They will be happily talking as backbenchers, but you ask them to come to the front and address the students, address a gathering, they may not be able to do that. And if you force them, because I have seen it in my 20 years of teaching, that they have to give presentations for internal assessment, and they make very good assignments, written assignments. If I ask them to speak for 5 minutes, that day they will give an excuse. Next day, I insist that they have to present. You will come prepared and present tomorrow. They will become absent. They would rather avoid the class rather than face their classmates. So these are minor, but they cause a lot of discomfort to the sufferers. And the phobias can be for against anything, and the phobias can lead to very restricted, limiting their free movement. That is another. And another one of these disorders is called obsessive compulsive disorder. That is also considered under minor mental illnesses. So obsessive compulsive disorder people, they are obsessed with few thoughts and few behaviors. For example, repeated checking of things. Like if you want to go out of the house, you will check the doors, windows, locks, switches, gas about minimum 10 times. So when you have to leave the house itself becomes very difficult because the checking itself will take you half an hour to 1 hour. So if they have to go out of the house at 9 o'clock, they have to start preparing by this checking ritual from 7:30 in the morning itself. So it severely hampers their ability to move freely. So these are some of the minor mental illnesses. And these mental illnesses can be treated with medication, cognitive behavior therapies, and what we call as psychotherapy or counseling sessions also. But they are time consuming and they require one-to-one discussions, group therapy sessions. There are various methods to treat them. So these minor mental illnesses definitely have an impact on the quality of life of the sufferers and to some extent their family members. And another type of mental illness which we are all familiar with, but we think it as a social evil, is the substance abuse or the drug abuse, alcohol abuse, and other things. So these abuses can become addictions, and the addictions are a huge burden on the individual, family, community, and society, whether it is alcohol, tobacco, or the drugs. And there are very many types of substances on which the abuse can happen. And nowadays, with the easy availability of a number of drugs in the open market and black market, the youngsters are again getting severely affected, and that will cause a huge amount of burden on the family as well as the individual. Then we have psychophysiological disorders. These psychophysiological disorders have something called eating disorders. And just a minute. Sleeping disorders, sexual disorders. These are some of the psychophysiological disorders. And also some of them related to, what we call as heart diseases. Also what we call as anorexia nervosa, bulimia nervosa, few of the eating disorders. Okay. And also we will all have sleeping disorders like not able to sleep at all or having nightmares. And these type of disorders can come. Sexual dysfunction can also happen. So these disorders, psychophysiological, they have psychological origin, but they have a physiological symptom. So they are another group of disorders. Then we have a group of disorders called personality disorders. The personality disorders are something which we are born with. They are some of the traits. We always say, in Kannada, there is a saying called Puttuguna Sutru Hogadu. And another saying, Bevu Belladali Idalu Yenu Phala. So the original characteristics, some of the personality characteristics that we have, can lead people to socially disruptive behavior. That is called antisocial behaviors. We can have neurotic personality disorder, can have anxiety personality disorder. We can have narcissistic personality disorder, a number of histrionic personality disorders. These types of personality disorders cause a lot of discomfort and disruption, not just to the individual, but also to the family. Then we have disorders of in children and adolescents. Children and adolescents can have psychiatric illnesses like major mental illnesses also, They can have anxiety, they can have sleep disorders, they can have a lot of phobias. Some of them are age-related, some of them are peer-related, some of them are related to the environment around them. All these things can cause children as well as adults to suffer. Then we have developmental disorders in children, which are basically related to mental retardation. And then we have learning related disorders, like for example, specific learning disability. And we have disorders of speech like stuttering, stammering. They can be physiological, they can also be psychological. So a number of children suffer from these types of learning related and also psychological issues. And like I said, when in developmental, we have mental retardation also. Then what are the causes? The causes can be heredity in case of major mental illness. And it can be environment in case of minor mental illnesses. Just to give you an example, if the father or the mother in the house shows a particular behavior, for example, seeing the cockroach or lizard, one of the family members is very scared and screams. The child which is observing that will automatically learn that behavior of screaming when they see the cockroach or the lizard. So that is some behavior which is being imitated rather than which may be something that the child itself inherently fears. So environmental factors can also mold an individual. If they have a mother who is very anxious or a father who is very aggressive, the children can inherit, not just inherit, they can also observe and learn these factors. And the personality itself can be a cause for any of these mental illnesses. Now we have to look at the treatment. What are the available treatments? Now, first and foremost, the first category, that is the major mental illness. The first mode of treatment is pharmacotherapy, that are medicines. They have to be given medicines regularly, and only then will they be able to show improvement. And the medication cannot be for like 1 day or 2 days. It has to be for probably minimum of 3 months to 3 years, depending on how long they have been suffering from the illness, what is the severity of the illness, and whether they have the family history of the illness, and how far they are responding to treatment. Based on all these factors, they have to decide on giving what we call as antipsychotic drugs. And when we give these drugs, it is not enough to just tell them to take medicine, but we must give education to the patient as well as the family about the treatment compliance, that is being regular to the treatment and not going to discontinue the medication. And then for minor mental illnesses, some minor dose of medication along with psychotherapy and counseling. Family therapy, occupational therapy, and psychosocial rehabilitation. These are some of the other methods, including behavior therapy, cognitive behavior therapy, which all can come under psychotherapies. They all are used for treating the mentally ill. So, with this, I would like to go to the next slide, that is prevalence of mental illness among women. This is my last slide for the first session. And after this, we will have a brief discussion and then we will take a break, come back and continue with the session. When we talk about mental illness and women, one of the major factors is that of impact of violence on women. It is said that on an average, 50 million people in the world are affected by violent conflicts. And of these 50 million people, around 80% of the people who are displaced and who suffer are women and children. whether it is Ukraine or Gaza, wherever people are suffering, the first victims will be women and children. And lifetime prevalence rate of violence against women ranges from 16% to 50%. And at least 1 in 5 women suffers rape or attempted rape in their lifetime. So you can see that women are more prone to being violated, being affected by violent conflicts, and becoming victims of violent conflicts. When we talk about minor mental illnesses, one of the things which I did not mention, because I want to mention it here, is a disorder called post-traumatic stress disorder. When people have undergone huge trauma, they are not able to overcome the impact of trauma very easily. They suffer from this post-traumatic stress disorder, where their mind replays the violence that they have undergone or the trauma that they have undergone. And they are not able to sleep, they are not able to sit, they are not able to stand, they are not able to concentrate, they are not able to do anything that they were doing efficiently earlier because of this exposure to the trauma. So post-traumatic stress disorder is one of the commonly seen, not just in the violence, in disasters also, natural disasters, man-made disasters. For example, post-tsunami. Even now, there are people, I have known a couple of naval officers, Indian naval officers, after being placed in Andaman Nicobar during tsunami. They came out of the service because they could not face the sea again after seeing the aftermath of tsunami. They have survived, but they have a major part of their life, occupational life, is gone because of that trauma. So disasters have an impact, natural or man-made, and they cause a lot of trauma. And neuropsychiatric disorders, as well as depression, they account for 41.9% of disability. That is among women compared to 29.3% among men. Okay, so women suffer from more of depression and anxiety, as well as neuropsychiatric disorders compared to men. And leading mental health problems of older adults are depression, organic brain syndrome, and dementia. And a majority of such problems are seen in women. So when we look at women as a group, we see that they are, as we will see after the next session, in the next session also, why so? But they are vulnerable due to some of these factors. One is that they have vulnerability to depression. They have vulnerability to exploitation, and the exploitation itself, when it becomes chronic, then the chance of them not able to get out of that exploitation itself can cause, which is a very natural reaction to being trapped in a situation from which the woman cannot come out. So that itself can also cause a huge burden on the woman. And that can lead to not just physical illness, but also psychological illness. So with this, I would like to open the session for question and answers.
Hello, madam.
Please.
Hello.
Hello. Yes, please.
Madam.
Please speak. You are not audible, madam. You are muted.
Okay. When children, they are having such a mental illness, then even parents themselves, they are not ready to show them to the counselors, because if they show them, even society, they may brand them as simply literally mad. So it will be difficult for them in their future. So by thinking in that way, they are showing very lukewarm response to go to this guidance worker or to the counselors, madam.
Yes, yes, very true, madam. Not just for children, even for the adults, this happens. Okay, it is not just the children, but also the adults also, they don't go, and that is where education is very important. What we call as psychoeducation is very important. If we are able to do that, then we can successfully help the child as well as the family.
Yeah.
Hello.
Yes, sir.
Ma'am, in some cases, to treat mental illness, they approach faith healings, as you said.
Yes.
But there is some success rate in that cases also. How is this possible?
Okay. Sir, this is actually a good question. For example, we call some of these psychiatric syndromes as culture-specific syndromes. Syndrome is a group of symptoms which are classified into a category. Okay, group of symptoms. For example, there is a syndrome called Dhat syndrome, common in North India, even in South India. For example, they say Mohini hidkombutide. And it is usually seen that the Mohini usually comes to the adolescent boys. And somehow it is related to the what we call ejaculation-related fears or impotence-related fears. And they say that this can be cured by some of the faith healing. Again, it is very culture-specific. It is not present in every society. It is present in that particular society only. So that is something that we need to look at when we are talking about culture-specific syndromes, and also to see that the individual gets cured, because some of this faith healing is what we call as self-induced, self-hypnotized can also be there. So that is something that we need to look at when we are talking about it.
Okay.
Sir, ನೀವು ಯಾರೋ ಮ್ಯೂಟ್ ಮಾಡಿಲ್ಲ. Okay, any other questions? I think there is some message in the chat box. No, nothing. Okay. Any other questions?
Madam,
yes.
I just want to ask a question. It's related to the students whom we handle in our colleges.
Yes.
And I had an experience with a student, not experience. She was actually a student who lost her father in the near future, and we had to undergo many family problems, and she had two younger siblings for her, and she got so I don't know what word I need to use. She's very afraid to leave them alone at the house. Her mother needs to go for work. They're not that financially well off, and it even affects her academic thing. She is ready to give up everything to take care of those two kids. She even skipped her exams, saying that there is no one to look after them. In spite of asking her to bring those two kids to college and we'll take care of them, write the exam, in spite of saying that she's afraid. So when we ready to go and talk to her. There are many people who say to us that you better don't get into such things. It will get into problems. So what can we do in the case of such kids? How can we talk with them or solve? We cannot solve the entire problem, but at least to the basic level, what can we do for them?
Madam, I think this child will definitely require a psychiatric or psychological consultation. I'm sure post a father's death. Sometimes we have seen cases where if the death is violent and they have seen something very tragic like self-harm or suicide or accident which the child has witnessed or the girl has witnessed, that causes considerable trauma and or some fear and anxiety about leaving the safe zone. That can be causing this type of behavior for her to refuse coming out. So she will definitely require a proper referral to a psychological evaluation. Only after that can her problem be addressed and she can definitely get out of it, I'm sure of it, and will be able to join the college.
The problem here is that, as Vani Madam said before, not ready to go for getting any type of guidance or to any other doctors. So that is also there. So it's a very big.
Yes, that is true, madam. And also a lot of fear of stigma. That is why, parents, will say we will rather get the girl married. We have had a similar issue. Again, a culture specific thing. The child saw something, she saw an accident happening in the 10th standard student, accident happening in front of her and 3 spot deaths. And after that, she started behaving in a very abnormal manner. And the family start thinking that one of the, dead persons has possessed her. And they went to all faith healers, despite, asking them to go and take treatment to reduce her anxiety and fear and also to stabilize her a little till she can, recover. The family refused. They went to all the faith healers. They got all the things tied to her hands and neck and everything. And then finally, they didn't want to send her for 10th examination. So all these things, I mean, it is a battle, madam. It is not easy. But finally, the girl finished her 10th and she passed also. And then after counseling, and she was also feeling better, some teachers took active help from counselors and they helped that girl. And now she has joined PUC, which is very good. Otherwise, family wanted to marry her off because they didn't want to keep her at home also. It is there.
I think this also happens with many children who belong to the backward communities, especially the SC community in our state, and they come from backward districts, and they, without having any trauma or any kind of things, they remain secluded. They don't want to be friends with anyone. They are like that. If we ask them to come out of their shells, they're not ready. They are both bad in their academics and in getting along with people. So that is also a very big thing in which we cannot, we are helpless at many times.
Very true, madam. But as teachers, we cannot let go. That is the thing. And we must hope that it can make. Yeah, we have to make that effort. Yes.
Yeah, we do try, make an effort always.
Yes.
And hope it will get okay.
Yes, madam. At least, if not now, I'm sure that the seeds of whatever knowledge you would have shared would definitely travel further. Definite. That is for sure.
Yeah. Thank you.
Thank you. Any other?
Ma'am, apart from giving psychoactive drugs for mood disorders, what are the other treatment options available for mood disorders, ma'am?
Sir, like I said, if it is a major mental illness, it will have to be medication. The first and most effective mode of treatment. And second, when we talk about depression, sir, there are two types of depression. One is called what we call psychogenic depression, and the other is situational. Sir, for example, what we call as life events, loss of a life partner. That is a life event, sir. You lose your spouse for whatever reason. Will the person be not depressed? They will be depressed. If they are not depressed, then it is abnormal. Right? So when we talk about mood disorders, there are external factors which trigger the mood. There are internal factors which trigger the mood. If the mood disorder, especially depression, if it is due to internal factors, then medication is the best way to treat. If it is the external factor, for example, common among college students is love disappointment, failure in examination, not able to get into a job, or being forced to do something which they are not willing to do, and low frustration tolerance. These are all commonly seen in the student population. So these things, for example, we have seen and read in newspapers about children committing suicide for being scolded for using the mobile apps too many times, or being refused to give a particular model of mobile for them. So these type of events, they are all external to, they are caused by external factors. So for those external factors, it is better to, increase their what we call as coping abilities and giving life skills training. These things help in dealing with the frustrations and disappointments in life and being able to face these exigencies of life. So that is one way to deal with the environmental factor related depression, or what we call minor depression or neurotic depression. But major depression, we will have to go for medical treatment only, sir, to overcome that, in intrapsychic depression. That is the best option available.
Thank you, ma'am.
Welcome, sir. One last question before we break for tea. Everyone is ready for tea, I think. All right. So before I conclude, I just want to summarize what we have covered so far. We have defined what is mental health, what is mental health, and what is mental illness, what are the types of mental illness, and also what are the causes for mental illness, what is the magnitude of mental illness, what is the impact of mental illness on individual, family, community, and the society at large in terms of economic, social, emotional burden which the family as well as the individual carries. And we have talked about available treatment options. And lastly, we have also covered about the mental health, mental illness, and women. Why women as a category are vulnerable to mental illness due to the stress factor which is there due to exposure to violence and trauma much more in comparison to men. We have also explored the myths surrounding the mental illness, and these myths cause a major hurdle in accessing the treatment, availing the treatment, and also affordability of the treatment. The other hurdle in taking treatment is due to the limited number of resources which are available for the patient and the family in terms of mental health manpower, in terms of mental health facilities available, and also the medication. So these are the things that we have covered so far. So we will meet again at 11:45 and continue with our session. Thank you very much for your patient listening.
Thank you.
Enjoy your tea.
Thank you.